Good morning to everybody from Auckland, New Zealand, and good afternoon to those of you in the US, and hello to everyone else. I'm really excited to welcome you here today for the seminar on the Great Plague Scare of 1720, Reflections in the COVID Era. I think it's been a terrific discussion, and just so you know, the meeting is being recorded. So anyway, my name is Chris Adams. I'm a professor of history at St. Mary's College of Maryland. I'm one of the associate editors for H. France Salon, which, as you all probably know, is a multimedia journal of French studies that encompasses history, literature, cinema, art history, theory, culture. I'm sure that many of you are familiar with the conference recordings that we house on the Salon and some of the blog projects, and we also do webinars, as you see today. So I want to offer a special thanks to our intrepid H. France editor-in-chief, Michael Breen, who agreed to step in to manage the Zoom logistics for this webinar in addition to his many other duties. So thanks for getting this set up. So, like many of you, I'm sure, I've been waiting enthusiastically to read Cindy Ermus's book, The Great Plague Scare of 1720, Disaster and Diplomacy in the 18th-Century Atlantic World, which was published by Cambridge University Press in 2023. Cindy is assistant professor of history at the University of Texas at San Antonio. She already has a very impressive list of publications on disaster and disease, but beyond traditional publications, Cindy has also worked extensively in the digital humanities. I suspect that many of you are familiar with her work as one of the co-founders and co-executive editors, along with Brian Banks, who I think I saw there in the audience, of the excellent online open access journal, Age of Revolutions. Now, I highly doubt that when she started working on the topic of epidemics and public health responses at Florida State University as a PhD student, that Cindy had any idea how relevant her topic was going to be as her book neared completion. And given the importance of the issue, she treats in the book, most notably how governments, local and national, respond to public health crises. I thought this seemed like a terrific topic for a broader discussion. So last semester, I approached Cindy about the possibility of putting together a webinar to discuss the implications of her research with some other experts in the history of medicine and public health. And so she invited some extremely knowledgeable colleagues who graciously agreed to join us here today. So let me introduce them briefly as well. Jessie Hewitt is associate professor of history at the University of Redlands in Southern California, and her research focuses on the history of gender and disability in the modern era. Jessie published her first book in 2020 with Cornell University Press, titled Institutionalizing Gender, Madness, the Family, and Psychiatric Power in 19th Century France. Her most recent publication, which is on the topic of medical confidentiality and sexually transmitted infection in the late 19th century, is actually featured in the edited collection French Histories of Sexuality, which was edited by Nina Kushner and Andrew Israel Ross. Sara Black is assistant professor of history at Christopher Newport University in Newport News, Virginia, which is not far from my usual home. Her first book, Drugging France, Mind-Altering Medicine in the Long 19th Century, was just published with McGill Queen University Press, so congratulations on that. Her next project focuses on the history of tuberculosis and public health during the and after World War I. And finally, Junko Takeda is the inaugural Daykoff Endowed Faculty Scholar in the Maxwell School of Citizenship and Public Affairs at Syracuse University. Like Cindy, she is also an expert on Marseille in the time of plague. Her first book, which was published by Johns Hopkins University Press in 2011, was titled Between Crown and Commerce, Marseille and the Early Modern Mediterranean. Her focus then moved from the metropole to the empire with her second monograph, The Other Persian Letters, Iran and the French Empire of Trade, 1700 to 1808, which was published as part of the Oxford series in the Enlightenment by Liverpool University Press in 2020. And she's currently working on what appear to be two very different projects, Avedek, the King's Armenian Prisoner, A Global History of Kidnapping, Conversion, and Madness, which I'm guessing is a microhistory, and then also what appears to be a more personal work, Secret Lives, Lost Voices, a Japanese Korean American memoir. So welcome and thank you to all of you. Just to briefly sketch out the format of our webinar today, first, Cindy is going to start by providing a short introduction to her book, followed by some preliminary comments by the other panelists. I then have a few questions that I hope will help link the issues raised in the book to current concerns, and then we'll open the floor to questions from the audience. And we'll get to as many of the questions as we can in the hour we have today. So Cindy, welcome.
Thank you so much, Christine, for the wonderful introduction. Thank you to the folks at H France, of course, for hosting the invitation. Panelists, thank you so much. I'm eternally grateful for your willingness to participate. Audience, of course, on a Friday afternoon, thank you also for coming. I wanted to take just a brief moment here at the beginning to mention the very sad, tragic passing of Laurie Wood, fellow historian of France, who passed away at her home in Philadelphia a week ago today, I believe. I have been struck by the number of lives that she touched. I didn't have the honor of getting to know her very well. We only met in passing once or twice at conferences, for example, in Tallahassee. But it's just a tragic, terrible loss for our profession, and above all for her family and for her two children. So just kind of wanted to mention that, just take a moment. So what I'll do now, as Chris mentioned, is I'll very briefly kind of go through a couple of main kind of highlights, I guess, from my book, a quick spiel, as it were, and then and take it from there. Mostly for those of you who haven't read it. So the basics, I guess, what it was. The focus of the book is the 1720 plague of Marseille, or I typically call it the plague of Provence throughout the book, just to highlight the fact that although it entered or started in Marseille, it very quickly spread from there throughout the entire region of Provence for the most part, and even into parts of Languedoc, neighboring provinces and regions. This was a case of bubonic plague for the most part. There were pneumonic cases. The evidence suggests that there were also cases of pneumonic plague, which is to say, whereas the bubonic plague doesn't spread through droplets in the air, for example, or from person to person. It's not contagious. It's through the bites of infected fleas that bite infected rats. The case of the pneumonic plague does spread from person to person through infected droplets and this kind of thing. So, so it took place, as I said, in the region of Provence. It lasted beginning from May 1720 and really exploding from July of 1720 through the fall of 1722. So really the tricentennial just ended a few months ago, as it happens. Upwards of 100,000 people may have died altogether, right, in the affected area, so not just in Marseille. Different numbers are thrown about for how many died. As we know from COVID, even today, even now as we speak, it's difficult to know exactly how many people die in any epidemic or pandemic. It was certainly the case back then. But I played with some numbers in the book, and I came up with a rough estimate of about 126, 125,000 people lost their lives in those 2.5 or so years. This is a transnational study. My book doesn't just look at what took place in France. That's chapter 1. Chapters 2 through 5 look at other parts of Europe, and chapter 5 looks at the overseas colonies, particularly of France and of Spain. And so each chapter proceeds in order of distance from the hot zone, if you will, right, from Provence. And so I look at Genoa, port city of Genoa in Italy, or various port cities in Italy, Great Britain, Spain, of course, France, and as I said, the French and Spanish colonies, especially Martinique in the case of the French colonies. The main argument, most fundamentally, is this concept of disaster centralism, what I call disaster centralism, which is to say that this phenomenon today that we see typically, right, today throughout the globe, really, when disaster strikes, there's an expectation that the head of state, right, the person in charge will step in and either control what's going on, take care of it, fund the enterprise. Today, they're expected to show up, in times of crisis in person whenever there is a shooting here in the United States, or whenever there is a major flood or a hurricane. In the case here, in recent decades, of course, the president or the governor or the mayor and whoever it is will show up in person and all these kinds of things. really started to happen in the beginning of the 18th century. And the Plague of Provence marks a very significant moment in that history. So this is kind of the beginning of what I call disaster centralism, or the centralization of disaster management, that although it has not been a neat continuous line or increase, it's certainly the case today, right, with fits and starts, though, as we can discuss a little later. And just to sum up my research, I conducted research in about 20 archives, different collections, so archives, libraries in Europe, a few here in the United States. I looked at consular papers, sermons, contemporary artwork, newspapers, family papers, of course, the correspondence of public health officials, heads of states, representatives, ecclesiastical authorities, and so on. I think just to wrap it up, that's a kind of quick summary. So if you have any questions, of course, I'm happy to take them.
So Jessie, if you want to go ahead.
Yeah, so I want to thank Cindy for inviting me. I feel like I learned a ton from your book. And yeah, I'm going to keep my comments pretty brief so that we can get to questions, which I'm sure everyone is really looking forward to. I want to start by saying that this is a remarkable book. The story that Cindy has weaved together through deep archival research in multiple languages, in multiple locations, it's compelling, convincing, and bold. It is strikingly relevant to our present historical moment due to our own experiences with the COVID-19 pandemic. I found myself nodding my head in recognition throughout reading it. Just one example, many Europeans assumed that the plague in Marseille came from the Levant due to Orientalist attitudes regarding disease and contagion, while current scientific research suggests that local animal reservoirs might have actually been the source, which I didn't know this about, sort of current research on the plague's origins, but that was absolutely fascinating to me. This made me think about the current othering discourse surrounding China's role in the COVID pandemic. Discourse, of course, that has given fuel to the fire of anti-Asian bigotry in the United States. Also recognizable, of course, were the myriad ways in which politics, economics, and public health intertwined in response to the threat of plague. At the same time, this book also brings to life the concerns of people navigating a world very unlike our own, in which positive public health outcomes often coincided with the economic and diplomatic imperatives of centralizing states. After all, despite the death toll in Marseille and southern France, which Cindy sort of covered in her brief introduction, most people in this book experienced a plague scare and not a plague in the years between 1720 and 1722. And it's not often that I feel jealous of people in the early Atlantic world, but here we are. Of course, this too is a story about the limits of state power and the ways in which public health could be both mobilized and mobilized against in order to pursue economic and diplomatic agendas that sometimes had little to do with the plague itself. Plague in this case served to crystallize the competing priorities of numerous stakeholders within communities and between them. And it's therefore also a snapshot of whose lives mattered and why, which is again, an issue that remains sadly pertinent. And so thank you again, Cindy, for this chance to learn from you. I'm excited to hear more and excited to hear from the other folks who read the book too.
Thanks, Jessie. And Sara?
Thanks, all. So firstly, thank you, Cindy, for writing such a fascinating book. I am a modernist, so I learned more than a few things with this. And thanks for inviting me to be on the panel today. So one of the things I found most striking was what a remarkable and amazing example of transnational history this book is. This could so easily have been I mean, it shouldn't have been, but it could so easily have been a very regional, very local French study, or it could have been a global study that focused so heavily on France and the implications of, international commerce, health policies on French issues during a time of plague. But instead, it traces the reverberations of the plague of Provence around the Atlantic world, really exploring the political, economic, and social stakes of the crisis for the Italian states, for Spain, for England, for Martinique, and other areas in Spanish America. So it was really remarkable in terms of its breadth, its depth, the archives you visited. I was just very impressed. I learned a lot. So thank you for that. So this book demonstrates that although the plague never left southern France, it was not an isolated event by any means, but instead was an international crisis that had major impacts on commerce and diplomacy throughout the Atlantic world. So I really appreciated how each chapter kind of explored a different port city, and in turn exposed what the stakes were for the particular country or city involved at the time. So for example, you have Genoa, in the Italian states, coordinating sanitary policies between each other to protect their trade, their reputation, and their credibility, and then end up, working as a kind of mouthpiece for more reliable information about the plague in face of misinformation from Marseille and etc. Or Philip V of Spain, using the plague of Provence as a pretext for imposing harsher restrictions on trade with France and Britain, to try and tip the balance of power back in Spain's favor after significant losses in the War of Spanish Succession. So the book demonstrates that disaster measures and public health policies were major tools of state formation. As monarchies stretched their muscles with absolutism, centralization, and bureaucracy. So a lot of these policies are coming from the central state, from the heads of state, in ways that they hadn't really done in the past. Yet at the same time, the plague measures also exposed the very real limits of state power, from the difficulties that France and Spain had in controlling the actions of their colonies in the Americas, right? Essentially telling them to figure out as best they could what to do in this situation, to Britain's inability to control its own citizens and to enforce its quarantine measures in the face of citizens' resistance and opposition to these measures, claiming that it was a violation of civil liberties. So people's expectations of state action and aid have only increased in the modern era. And we have all sorts of new tools in terms of centralized power, in terms of industrial capacities, and communication has improved significantly from the weeks and months it took for letters to get different places in a time of crisis. But moments like the COVID-19 pandemic continue to expose the limits of state power, from the difficulties that the US and France and other countries faced in securing ventilators to treat COVID patients in the hospitals in the summer of 2020, to the ongoing challenges to combat misinformation and persuade citizens to alter their behavior in the name of public health. So as your book demonstrates, economic competition, diplomatic rivalries, and national interests shaped different countries' responses to the plague in 1720. And you note that public health measures during this crisis were not only, and sometimes not even primarily, about saving lives, tragically enough. There were many different social, economic, and political forces at play in this disaster response to the plague of Provence in 1720. And exactly 300 years later, global communities are still grappling with many of these same issues and interests. So I will keep it brief so we have plenty of time for discussion, but thanks again for writing such an amazing book.
Okay, thanks so much, Sarah. And finally, Junko.
Yeah, thank you so much for inviting me to be part of this conversation celebrating the publication of this exceptional book. I've known of Cindy's book project actually for many years, ever since she reached out to me when I first started in Syracuse many years ago, since we share our research on Marseille and the plague in common. So I'm super happy to be here to offer my comments and my praise. And reading the book also reminded me how little I knew about the plague of 1720 when I first wrote about it. So I'm so happy to see the ways in which the scholarship has really expanded since then. So I'm going to try to keep this brief. Like everyone else, I just want to point out 3 themes in the book that I'd like to foreground, themes that I think make this book particularly important for us today. So the first of these themes is the book's interdisciplinarity that I feel is really worth foregrounding for today's discussion. So Cindy mentioned the enormous amount already of archival evidence that she's explored. It's truly remarkable in terms of the linguistic facility as well. But here I want to draw attention to the first sections of the book, where she provides a very careful discussion of the history of the appearance of the so-called plague, la peste orientale, right? The peste levantina. And she quickly, critically examines the repeated narrative of the plague, whether it was bubonic plague, whether it arrived on the Grand Saint-Antoine, whether there were multiple introductions of the plague in 1720. And she draws on advances in ancient DNA sequencing to explore how current knowledge of endemic European plague strains forces reconsiderations of what we long accepted about the European outbreaks in early modernity. Did they really come from Western Asia, as Jessie mentioned earlier? So this interdisciplinary engagement with genetic studies and the mapping allows her to provide a much needed reparative lens in calling out epidemiological Orientalism. And that, as we'll probably discuss in further detail later, is so relevant and resonant in our own age as we deal with anti-Asian violence, COVID scapegoatism, and all kinds of disinformation. So the second, the story of centralization, right? It's long been central, no pun intended, to scholarship on old regime France, from Tocqueville's criticisms of it in Old Regime and the French Revolution, to more recent works that focus on the limits of centralized bureaucracy and the resistance to it. In my own work on Marseille, I tried to highlight that tension between statecraft and localism. And now scholars of empire and colonialism, I'm thinking here Tessa Murphy, Sophie White, the late Laurie Wood, of course, many others, are drawing our attention to the interstitial spaces of empire, the ways in which those spaces allowed for indigenous, enslaved, and creolized societies' politics of contestation. Now, what I really appreciate about Cindy's book is how she captures this dynamic on a local, global, and transnational scale, right? She highlights the tensions between municipal claims to autonomy and statecraft through the development of disaster centralism across the Mediterranean and the Atlantic. And she goes back and forth between what unfolded in Marseille, Genoa, London, and the broader Caribbean. Now, when you read her book, you quickly realize that it's much more than what the subtitle says, Disaster and Diplomacy in the 18th Century Atlantic World. I think it models for early modernists how we can integrate regional studies of the Mediterranean with the broader Atlantic and Caribbean worlds. And I think that those of us here who are Mediterraneanists are super happy to see that, see those connections being foregrounded. Because she stresses how interconnected these zones of empire were, right? More so than we've traditionally acknowledged. So I think that true global transnational perspective is a major strength of her work. And then finally, the discussions of the fears of public health crises felt globally helps us to reconsider some lasting assumptions of the Enlightenment. One of the important through lines, I think, of her book is that public health restrictions and disease centralism appeared not just to ward off medical crises. They were also connected to threats to port credibility, commercial relations, reputation, but also to illicit trade, smuggling, and bullion leakage. And in this charged environment, rumor and disinformation played as large a role in determining policy, if not a larger role than science and facts. The Age of Enlightenment, if we can still speak of it as an age that appears in Cindy's book, is not just one of empiricism and rational science, but also one of mis and disinformation and information blackouts. It's not an age just of du commerce, but one of violent imperial trade wars, and the rise and expansion of fiscal military states, similar to what Michael Quast described for us in his study of contraband and Louis Mandrin. And those themes that bring together considerations of fear, rumor, border controlling, fear of foreigners, and trade wars really resonate so deeply in our current age, not only an age of globalization, but one of environmental degradation and climate change-induced dislocation, dispossession, and mobility. So I'll stop there, and I hope that provides some more avenues for further discussion about the timeliness of this wonderful book. Thank you.
So thank you so much, Junko. So what I wanted to do is I have a few questions to get things started. And if others have questions, if you'd like to post them in the chat, please go ahead and get started. And we'll try to get to those as many as we can before the end of this hour. So anyway, my first question has two parts. One of the issues we encounter in Cindy's book involves conflicting narratives that emerged during the Plague of Provence, right? So you have public health officials across Europe who obviously wanted to know what was going on in Marseille and Provence, right? But the officials on the ground continually claimed the pandemic was over. There was nothing to worry about, when in fact it was not, right? And this caused a great deal of confusion for people, particularly in the first months of the epidemic, which all sounds kind of familiar once again. And this brings to mind two separate points that I think we'll agree remain issues today. I mean, first of all, then as now, what brought the epidemic to an end varied according to a number of factors, which once again, I think we can all appreciate ourselves now, but did the experience of the plague in Provence provide us with insight as to how pandemics or epidemics end? And then the second question regards misinformation, which Junko is just talking about here. But what did we learn about how misinformation operated during the plague of Provence, and what were the consequences of that? And once again, what are some lessons we can draw from that? So Cindy, if you want to go first, and then the others just jump in.
Sure. Thank you so much, Chris. I appreciate it. So to the first part of the question regarding how pandemics or epidemics, in this particular case, end, it's funny. So when I was thinking about this recently, I remembered something. My husband actually reminded me of something that that I said probably 2 years ago. So earlier in the pandemic, which was, that saying, avoid like the plague. Can't use that anymore. Right? Turns out it's no big thing. Nobody avoids the plague. It's like, who cares? It's already over. And this was, like I said, almost 2 years ago. So, so that came to mind when I was thinking about this question of how epidemics end. It's certainly not as simple as dwindling numbers, right? Dwindling case studies or dwindling deaths. A number of factors determine it, in my view. Yes, case numbers and the numbers, as it were, to some degree, but also when does a people decide to live with it? When do they decide that they're over it? That's one thing that has struck me during our current pandemic, because that, in a lot of ways, in my view, helped to drive almost secondarily when the state, for lack of better terms, decides to end it or to declare it over, in the case here in the United States recently, by lifting all of the measures that were in place, certain protections and money and that kind of thing. Part of it also depends on how we define a pandemic. How do we define an epidemic? In the case of the pandemic, does it have to be global? If it's still affecting part of the globe, so geographic questions about what defines a pandemic might determine how it ends. As well as, like I said, case numbers and the number of dead. It's almost relative. It's almost like different people view the end of a pandemic in different ways, kind of thing, right? But I invite my co-panelists to jump in as well.
Well, one thing I was thinking about, I think it relates actually to the comment that you said a couple of years ago about avoiding things like the plague, I guess maybe not, is that the end of the pandemic, at least, the way we're experiencing the current, sort of so-called end of the COVID-19 pandemic, it definitely feels as if it's not so much about the end of a public health threat as the end of our perceptions that a public health threat exists. And so, there's so many different things that go into that perception, but not so much, case numbers, for example. Right now, it's sort of, well, if we don't have access to information about case numbers, that seems to be the that counts as it being over. So yeah, it's interesting. The example from your book that feels really pertinent was how you discussed the laws that were put in place in Great Britain, which were really pushed back against in a way that similar laws in Spain, for example, were not pushed back against in terms of their general population. But you have the laws in Great Britain being reversed and repealed in response to people's frustration over what they saw as the economic impacts of quarantine and other sort of, things that went on. And it was not in response to anything on the ground, because plague never actually entered Great Britain to begin with. So it's very much this sort of wider economic context that seems to be driving, the quote end, in a way that, was also present, interestingly enough, in terms of defining the beginning of the pandemic in Provence, where the pandemic started. It never really starts in Great Britain, but then it also, how did it end? It's a really fascinating case study, I think.
Yeah, Jessie, I'll piggyback on what you just said there at the end, right? The beginning is just as fuzzy as the end, right? I mean, kind of the fact that for so many weeks, in 1720, the local administrators, as well as the doctors that they were employing, like Chiquana, said that it wasn't the plague, right? And it just reminds me of March 2020 that we've decided is when COVID started, right? But it wasn't, right? And it didn't come in the way that we thought it did. It was probably here many weeks, if not months prior, right? So kind of when do we say that it actually starts is just as kind of a question mark is when we decide that we're gonna will it to be done so that we can get on with things.
I piggybacking on everything. I think that it really depends. Perceptions of when a pandemic is a so-called emergency and when it is just a pandemic that is no longer an emergency but still has significant case counts and things like that, is really dependent upon your perspective. And so like Cindy, I think that a lot of this is the plague being over politically or over in terms of international decisions and individual experiences, being fed up with measures, seems to shape the end of the pandemic more so than case counts. And of course, once you declare the emergency is over, there's already a systematic underreporting, and then you no longer have the kind of systematic measures of case counts and things like that. So what was a kind of continuous marker of where we are in the pandemic and how the pandemic is moving in terms of these statistics over the course of the last few years has become not really a measure of what things are actually like on the ground. And then, of course, individual experiences are going to shape your perceptions of what constitutes an emergency plague and an emergency pandemic or not. The immunocompromised population, or if you're not young and wealthy and healthy, it's going to change your perspective on when a pandemic ends.
Yeah, I mean, it seems like it's coming back here. COVID appears to be, rates seem to be rising in New York again and all this stuff. And who knows, maybe it will repeat over the next 300 years like the plague originally. But I have a question in the chat from Brian Banks and one from Jillian Weiss. So let me read Brian's first. He said, my question is about plague memory. It likely became a landmark of memory, a shared experience that colored a generation. Did you find historical actors decades on still acting as if a plague would break out at any moment? COVID, like 9/11 in the US, is certainly going to be a landmark of memory for people across the world.
Sorry, thank you for the question, Brian. Yes, up to a point. So what we see is that pandemic memories are short. On the one hand, in some ways they're short, and on the other hand, they're very, very long. So with the case of the 1720 plague, there remain to this day a number, many monuments, street names, just museum stained glasses, excuse me, not museum, cathedral, like stained glasses in a cathedral in Marseille. There's all of these markers, there's all of these monuments to the 1720 plague, but before the 1720 plague happened, the last plague or significant outbreak in France had been decades earlier. And so what we see, and this is not just the case in France, but what we see is that a lot of times by the 18th century, these major epidemics are catching people by surprise in some ways. And so there's also the question, the fact that in Western Europe, at least, this was one of the last outbreaks of plague. There would only be a couple more in the 1740s in Messina and in Ceuta and in Spanish territory of Northern Africa. And so the bigger issue ceases to be plague and turns toward yellow fever, which is a big, continually reappearing at this time. So this is all to say that what was learned during the 1720 plague was continually reapplied for these outbreaks that came later of yellow fever and of also, of other diseases that showed up across the Atlantic, everything from malaria and even smallpox, decreasingly so over the 18th century, but nevertheless. And yet the fear of plague in particular, it's not as palpable in the documentation as the 18th century draws on and by the 19th century, because the attention has turned to these other diseases. Sorry if I explained that, but does that answer your question? I can't see you, but yes.
Would anybody else like to weigh in on that, or should?
Yeah.
I guess I can just kind of piggyback on that, Cindy, right? Because I mean, I too see, kind of going to Marseille, all the markers, the street signs, the intendant sanitaire is still there, right on the port. I think in terms of kind of places that are more hidden, and kind of looking at the ways in which people become a little wary about international commerce, right? And there's the kind of backlash against, global trade and things like that, like the Academy of Marseille, for example, that's created in a few, I can't remember the exact year, but a few years after the plague, right? The Academy is formed, and they choose as their emblem the phoenix rising out of its ashes, right? And there are these kind of speeches where they're talking about how we can still be a commercial city while at the same time warding off the dangers of plague. And so I think in the local discourse, that kind of hangs on for a few decades.
So let me read Jillian's question here. She says, I'd love to know more about the response to the plague of Provence in the colonies. Was blame apportioned differently there than in metropolitan France? Did you find anything about negative of Provence and or of Marseille by association with the Levant?
Hi, thank you so much for the question, and thank you for coming, Jillian. You've noticed I cited your work in the books. Jillian has also worked with Meredith Martin on the 1720 plague, so thank you. But yes, the short answer is yes, absolutely. So what we see is that in the case of Martinique, for example, which was a big focus for the chapter on the colonies, any association with or rather Marseille's and Sète, the port of Sète, also the association with the Levant made it to where and there's a question about how genuine it was, whether it was just for the purpose of commercial competition as a way to drive out commercial competitors, basically merchants of Marseille and of the port of Sète, which were seen as competitors, or was it actually a genuine fear? But nevertheless, the fact that there was a ship that came into to Martinique from Marseille, or from Sète rather, in this particular case study I'm thinking of, it was used, the fact that its associations with the Levant was used as the pretext to either drive it away or it would be burned in port. Its crew would have to come onto land. They would be stripped naked and bathed in the sea several times. They would be shaved and all these kinds of things. The bigger point being that none of the merchandise would be able to see the light of day on the island because of fear of infection. even though by this point, as I said, the port of Set wasn't even necessarily, it was just its association with the Levant, and it's the risk of a possible infection that made it, anathema, that made it a major risk and created even protests on the island. And so, yeah, that was a big question, or a big issue, I should say, in the islands, in the overseas colonies in particular. The history of Marseille with the Levant. Yes, go ahead.
Maybe I could just add something. Thank you so much for that answer, which was just like one thing that always struck me about Marseille then and today is the way that the city itself gets associated with the Muslim world and the Levant, and therefore, in a way, like understood as sort of essentially un-French and contaminated in itself in some way. And so I guess I was sort of worried, thinking about that. And also to add on to Brian's point, I mean, this is just a funny anecdote, but for the 200th anniversary, maybe this is a 300th anniversary, there was, a desire before COVID struck, to try to, commemorate it in one way or the other. And apparently the art museum wanted to do a big show, and the mayor's office was like, okay, well, that's fine, but as long as you don't put the word plague in the title, because they didn't want that kind of memory and commemoration of something so negative, because they're still dealing with like a reputation problem.
Oh, that's fascinating. I wasn't aware of that. Thank you.
I guess not a surprise, right?
Yeah.
So, yeah. So I wanted to just follow up. Brian had a follow-up to his question here, to you, Cindy, specifically. He says, I still don't know how you managed to write this stellar book as the world felt like it was falling apart during the pandemic. Can you talk a bit about how writing this book helped you to process what was going on around you? Which I think is a really interesting question. So.
It is. Thank you. That's a good question as well. I'll tell you what. So in terms of the logistics, we really buckled down for the pandemic, of course, right? Like all of you. And I was living away from, we're living here in San Antonio, away from family. I have some family living here now, but I didn't then. So it was really just me, my husband, and my little boy in the apartment all the time. Baby naps meant I would write. And because I didn't have anything else going on, I wasn't teaching in person and all this kind of stuff, it actually, and I know not, this wasn't the case for everybody, but I actually found a lot of opportunities to actually make it happen, to do the writing. And in doing so, my gosh, yeah, to say that our current moment influenced a lot of what went into the book is an understatement in a lot of ways. I had a lot of realizations, not only about what the past or how the past informed or informs, as I said, the current moment, but also how the current moment informed the history that I was writing about the past. There are some things that I wouldn't have thought of otherwise if it wasn't for the fact that I was writing during a pandemic. For example, this concept of misinformation in the 1700s. I feel like what was going on over the last, and what continues to go on here currently over the last few years, helped me to better understand the dynamics there and kind of the complexity and how it very much varies from case to case. The way misinformation unfolds during any particular crisis, the interested parties, the reasons why. These things don't necessarily translate from one epidemic or one pandemic to another, but fundamentally, the fact that it happens, the fact that it happened then and that it happened now, just kind of, in some ways, these two moments, these two experiences, these two histories spoke to one another, just if that makes sense. And so, also in terms of when I was trying to figure out, like, how many people lost their lives during the plague of Provence. And this goes for any disaster, for any kind of crisis, any kind of catastrophe where people lose their lives. So not just necessarily epidemics, but the Turkey earthquake, for example, recently, like how many people lose their lives is so difficult to get your hands on. Whether it happens now, whether it happens 300 years ago, 500 years ago, 100 years ago, 50, And again, the reasons for that, right? The number of factors that go into determining to actually getting an estimate of how many people die. You would think that today we can figure it out. We can't. So that's just a couple of examples, but yeah, absolutely. Like I said, the current moment, it went in both directions. You know, writing the history helped me understand the current moment, and the current moment helped me understand and write the history.
I mean, I think that as we've lived through a very complicated historical moment over the last 8 years or so, I mean, we have thought about the past in very different ways. I mean, and another question that sort of arises in chapter 3, you talk about reactions to the plague of Provence in London, which highlights the kind of resistance to protective health measures that emerged in Great Britain, for example. And so did you see similarities or differences between the resistance to public health measures then versus now? And are there sort of larger lessons that we can draw from that?
Very briefly, and I'll pass it to my fellow panelists, but one of the things that struck me about that, so yes, absolutely, as I said a few moments ago, the fact that it happened then, it happens now, and the way it unfolds is what difference, and the reasons for it, the interested parties that who participates and why these things change from one case study to another. But it's almost, in my view, at least, a given that it will happen. Misinformation has always happened. It's not a new thing. It's made more complex by the internet, of course, and the extent to which the entire globe is connected now through these communication networks. But it was there then too. But one thing that I am still grappling with when I've revisited the writing, the book, even in conversation, is, in the case of England, these movements of resistance were there. They were in the documents. They floated above the documents in the archives. It was like right there. I couldn't miss it. I had to write about it, and it was so fascinating. There was so much material there about these voices resisting public health measures, the reasons why they did it, who did it, and how it unfolded. Whereas in the case of Spain, for example, I didn't get any of that. The materials just weren't, and that's not to say that nobody resisted the public health measures there, which were far more severe in Spain than they were in England. But it's not in the materials in the same kind of consular letters or, the correspondence of the heads of state or ecclesiastical authorities, anything. The only thing I would find a few examples of were people very carefully worded letters petitioning the royal government. Oh, we're starving here. Can we please be able to making silk, to make our silk again? Can we please start harvesting our silkworms again? Can we keep our bulls? Can we start doing these things that the Spanish government stopped for public health reasons? All of these kind of measures. Can we start doing them because our people are starving here? Instead of the more forceful tone that you get in the case of London, for example, that it's like, oh, despotism, immediately, like, you're trying to act like despotic France. How dare you try to use the public health as a pretext? The word pretext is all over the archival documents, to try to control the people and to clamp us down. It's all a conspiracy, right? Conspiratorial this, conspiratorial that in the documents. So that's just one of the things that struck me in a lot of ways, but I'll hand the floor over. Sorry.
Just
Junko,
a quick
you're unmuted
question.
there. Oh, sorry.
Yeah.
Oh, I was just going to.
Oh, go ahead. Sorry.
Oh, I was just following up on that, Cindy. I was going to ask if I can't remember if Britain had their penalties for public health on pain of death, like I think Spain did, but maybe that might have had something to do with it, the consequences of protesting. But I don't want to interrupt. Go for it.
Well, just very quickly, yes, for some of the measures, but not for all. So it depends on which one, kind of thing.
Yeah, so one of the things I was struck by is the use of the word liberty, right? Because in the 18th century and in the present, it's such a different word. Like Marseille's municipal leaders, or kind of wanting to have the municipal liberty, the autonomy to make their own decisions about when to start the quarantines or when to end them, et cetera, right? And that kind of liberty is very different from the kind of individualism run wild that we have today, right? I don't think that really existed in the 18th century. So kind of, but it's really interesting that, it's our liberty, if not, it's despotism, and we still have that, right? Fauci can't decide for us when we wear masks and when we don't, but it's a very different kind of vocabulary now. And I was really struck with that, or by that.
Well, we've just got a couple minutes left here, but I wanted to ask one question, sort of gets at the heart of what you talk about in the book. I mean, the main argument of the book is the plague of Provence represented this sort of important formative moment in what you call disaster centralism, or the centralization of disaster management. And, as we've lived through this, it's sort of interesting to think about how that has changed in the last 300 years and how public health management more generally has changed. And what has COVID done to that in terms of our ability to manage public health crises? Has it set us back, or does history maybe suggest that there is no good way to manage an epidemic or a pandemic? And we're all doomed.
I'd be very excited, very interested to hear what the panelists and anyone in the audience has to say about this, if there's time, which I guess there's not a whole lot of time, but very briefly. As I've mentioned, in the book, it hasn't been a continuous line of increasing centralization from the 18th century or from the 1720 plague to today. There's been a lot of interruptions, a lot of pendulum swings, so to speak, as well. And but generally, as I think we might all agree, the case today is that when disaster strikes, whose responsibility is it to step in? Whose fault is it? Even in a lot of cases, people often look to the centralized government, right? And their expectation is also there for the centralized government to step in and clear up the mess, as I said, and send in funding, send in people, personnel, so on and so forth. But even today, one quick point I want to just kind of make about this is that even today, the pendulum might be swinging even now. And that's not to say that it's swinging completely away from centralization. I don't believe that's the case. I think it obviously is not the case. But there has been, because of recent administrations, think of Katrina, 2005, think of Hurricane Maria in Puerto Rico under the Trump administration. There have been some perceived failures on the part of centralized government in times of disaster, in times of crisis. And so people have increasingly, and I think of Houston during Harvey, all the stories that I was reading about at the time, people are increasingly looking back to the local government or local communities or local churches, to neighbors in times of disaster, because they've lost faith in the centralized government. So that's kind of another aspect of this movement, this phenomenon, I guess, for lack of better words, as well as when the pendulum swings, in which direction does it swing? And right now it seems like there's a lot of movement back toward local entities.
And you also mentioned in your epilogue, Cindy, the privatization of disaster management, which is also super interesting. And, frankly, like, to me, sorry, my cat is so annoying. That seems more ominous than these so-called threats to liberty coming from the centralized state, because the clash between the economic interests of capitalists and public health is, it just seems much more stark. And so I loved your epilogue for bringing up all those things.
So any other comments, or as we draw things to a close here? Well, this was great. Thank you so much to those of you who were able to show up today. Thank you to our panelists. This was a great discussion. Thank you so much to Cindy for writing this fabulous book and for being willing to share your expertise with us. And this will be posted on H France Salon. So I'm hoping that some more people will get a chance to watch it in the future. But thanks all for coming.
Thank you all. Thank you very much. Have a great weekend.
Yes, enjoy the weekend.